Hello friends, I hope you all doing wonderful in your work and all of things. Friends, the today topic is what is draft PICS and EU GMP Annex 11 that is released on July 2025. This is requested to all of you. Please watch this video till end so that we can understand the written statements in this guideline and how can we interpret it and comments on this. So first of all, I want to give declaration that this presentation is intended solely for education purpose and does not contain any confidential information pertaining to any company, organization or authority. The content herein has been synthesized for available regulatory guidelines, academic literature, and research paper in the public domain. It is solely intended for knowledge and understanding purpose only. So friends, first of all, the short introduction about the guideline. We all know that in November 22, EU Commission published a concept paper. If you remember that concept paper released for Annex 11 for computerized system. You can see the videos also on this concept paper. I have added a description in below this video. So Annex 11 came with the newly added new Annex 22, that is artificial intelligence, and revised of chapter 4, that is documentation. The comments on all three we have to submit until up to 7 October 2025. So this is written in the site of EU also. Same time, you can see in the PICS site also, they declare the same statement in PICS site also. So friends, first of all, we will understand what is the current Annex 11, right? And then what is the draft Annex 11 in a very short way. I hope you will with me till the end of this short video. So friends, first of all, current Annex 11. The current Annex 11 have journal, project phase and operation phase and at last glossary. So first of all, principle was there, risk management, personal supplier and service provided under the journal. Then project phase contain the validation part and operational phase contain data, accuracy check, data storage, printout, audit trials, change and configuration management, periodic evaluation, security, incident management, electronic signature, batch release, business continuity, and archive. On the other hand, in draft Annex 1, there is the 17 section plus glossy also, but we have scope, principle, pharmaceutical quality system, risk management, person and training, system requirement, supply and service management, alarm, qualification validation, handling of data, identify and assess management, audit trail, electronic signature, periodic review, security, backup, archiving, and then glossary. If we see, the reconstructed topics are security, identity and access management, qualification and validation, audit trail, supplier and service management. While validation is by far the most comprehensive topic in the current Annex 11, the new draft show a clear shift towards the topic of security, identity and access management, and audit trail. And we can see easily that the draft Annex 11 has grown from 5 to 11 pages now. This is the short introduction about this. And then what is the introduction in Annex 11 draft? First of all, the guideline prepared for these four purpose, or you can say these four content and cover in this guideline. First of all, evaluating IT landscape. What is this? Technologies like cloud compounding, AI, and digital performs are new, deeply embedded in pharmaceutical manufacturing. The old Annex 11 from 2011 does not fully address these. We all know about that. In Annex 11, that is currently effective, this is not available. That what is the cloud compounding, what is the AI, how the digital performance involved in the GMP activities. Second one, need for updated guidance. Why? Regulators recognize that companies need clear expectation for how to validate and manage these modern systems, especially when they impact product quality, patient safety, and data integrity. We all know very well the three pillars of our compliance, that is patient safety, product quality, and data integrity. So need of update this guideline required so that the regulators give a clear picture of their expectation on computerized system. Third one, global harmonization, right? Some regulators want something, other regulator wants something, but they want now a harmonized expectation. The revision aim to create a common regulatory approach between EU member state and PICS authorities, making inspection and compliance more consistent worldwide. Now, purpose of Annex. It define the requirement for computerized system used in GMP regulated activities, ensuring that these systems are for what? First of all, properly validated. Second one, secure and reliable, aligned with the quality and safety standards. So these three things required to be very clear for the user, for the regulatory market. So this is the purpose of the annex. So this is the introduction of draft annex 1. Now, first of all, scope. This annex apply to all type of computerized system used in manufacturing of medicinal product and active substance. As we see in previous slide, we will go accordingly the title. First of all, principle. 8 major points are added in Annex 11 for the principle only. First of all, life cycle management. We all know about the life cycle? Yes, computerized system life cycle. What is the life cycle? We know that concept phase, project phase, operation phase, and then retirement. So the principles say that the computerized system should be validated before use in your routine work and maintain your validate state throughout the life cycle of the computerized system. Second one, quality risk management. Quality risk management, QRM, yes. Before we have to check what is the risk, what is the hazard in my GMP work, how can I mitigate with addition of new computerized system, my application, what are we have, the controls and mitigation plan. So this is should be maintained and critical thinking again in this quality risk management expected by this guideline. And the approach according to guideline should consider the complexity of process, the level and novelty of automation, and the impact on the three pillars. What are? Patient safety, product quality, and data integrity. Then third one is alternative practice. What is the alternative practice? Yes, this is the new word, but what is the alternative practice? Guideline says that the practice which constitute alternative to the activities required in this document may be used. Maybe you can use some other practice that is guideline not listed, but They accept that if they have proven that documented to provide the same level or the higher level of your controls. So if you added some alternative practice, but this should be control high level to the expectation of the Annex 11. Then you know very well data integrity. So fourth point is data integrity. The guideline clearly written that we should follow the Alqua plus principle, as we will all know, but not limited to Alqua principle, but also the requirement of other section like handling of data, identify, access the management, audit trail, electronic signature, security. This should come in your data integrity plan, right? Then fifth, system requirement. System requirement. What is the system requirement? As a regulated user, we design the requirement for automation or computerized system when we are going to be implementing our GMP activity. So guideline clearly mention the requirement should serve as the very basis for the system qualification and the validation throughout the life cycle. Then six, outsourced activities. In this Annex 11, the outsourced activity or supply related activity very clearly mentioned, and we can understand very, and you can give the comment also if you face any trouble on that also. So outsourced activity, when we using outsourced activity, then regulated user remain fully responsible for adherence of the requirement. Means if you involved for the outsourced activity, regulator user whole soul responsible for everything. The primary responsibility for regulator user only. You can't say like this is the from the vendor. Okay. Next, security. Security. As we all know, the security is major concern in our industry. So guideline extended this principle clearly in 7 point, the security. So the regulated user should keep update about new security threat in GMP system, and measure to protect this should be implemented and timely manner. We have to check our security system and improve that and update that. This is the expectation in the 7 point of the principle of this guideline. Now, eighth one is no risk increase. This is what in the eighth point of the principle, which clearly mentioned there should be no risk in your three pillar: product quality, patient safety, and data integrity. So we have to check overall risk in overall life cycle of computerized system, and we have to implement some measures and controls during the operation that there should be no increase the overall risk of the process. So this is the 8 principal points of this draft guideline. Now the third one is pharmaceutical quality system. We all know very well with the production, with the manufacturing, with your tech transfer, with your marketing, we have the quality system each and every step. So why this computerized system behind? Why this will be not implemented in our computerized system? Never. We always implemented this. What is all type of deviation? Number one, right? In our validation part, in our operation part, what is the deviation? What is the non-conference? We have to be checked. We have to check the impact in your three pillar: product quality, patient safety, data integrity. We have to check the risk. We have to point out the root cause and then implemented our correction and preventive action. The second one is change control. If you want to be changed, even not limited to configuration, but your hardware and software component also, even its platform and that is operating system also. It should be in the control manner and in accordance with your defined procedure of change management, right? Where is the impact and how can we revalidate that? The procedure should be procedure should be very much clear in your pharmaceutical quality system. Now, third one is the internal audit. We all know the self-inspection and internal audit give us the opportunity to find out the lacunas, or you can say some deficiency that we have unintentionally or intentionally forgotten, can be come and give us the opportunity to improve our system. What system? Pharmaceutical quality system. So guidelines say that internal audit are planned, conducted, reported and followed up to detect procedure deviation and ensure the your three pillars are in okay condition. Okay. Next, fourth, regular management review. Yes, you got this. Regular management review. Regular management review cover all the relevant performance indicator for the computerized system and your process. Okay. And you have to be checked in adequate manner and adequate action you have to be taken. So regular management review record, although the guideline not describe about the what should be the performance indicator in that case. So my comment was that some example should be incorporated here. How can we review that? What will be the performance indicator? No doubt, what are the deviation, what is the challenges we are facing, what type of configuration we are challenges or we want to be changed. These are the some performance indicator, but some example need here. Now, fifth part, senior management oversee. The senior management responsibility mentioned in the fifth point of the pharmaceutical quality system in Annex 11, that senior management control by review the computerized system implementation throughout the life cycle. If there is need of some new technology, if there is need some resources, the senior management can help on that. So we have to promote that culture as a senior management, and this is responsibility written in senior management part of pharmaceutical quality system. Now, fourth part is risk management. As we all know, risk management is from our ICS Q9. So ICS Q9 reference is given by the Annex 11, draft Annex 11. So first of all, the risk management should be life cycle. Whatever high, middle, low, we have to be check in life cycle of the computerized system. Identify and analyze. We have to be identify each and every risk, either high, either medium, either low. And what is the mitigation plan? We have to identify. This is written in the risk management part. Then appropriate validation. We have to check potential risks in our three pillar of product quality, patient safety and data integrity, and how can we mitigate by the controls should be mentioned. So appropriate validation can give you the opportunity to mitigate all the risk in your GMP activity that govern through the computerized system. Then mitigation, yes, wherever applicability of the mitigation plan, if we got associated risk, the guidelines say your mitigated plan should be on acceptable level. Okay, acceptable level. The outcome of risk management process should be result in the choice of an appropriate computerized system architect and functionality. This is written. Now, data integrity. Data integrity, the QRM, your quality risk management, always remember that the three part: product quality, patient safety, and data integrity. So we have to remember that data integrity is the major part of your risk management. So this is written in also Annex 11 in the risk management part. Now fifth part is related to personal and training. Personal and training. This is written in Annex 11 that corporation means we are the team. Regulator user is not a one or two person or the department. This is the regulator user. This is the team. So either you are process owner, either your system owner, either your user, either your SME, QA, QP, internal IT department, vendor, and service provider, they have the internal cooperation to execute the show, right? The internal cooperation execute the show, and the show will be hit if we cooperate to each other. Then trainings, all these parties should have the appropriate training, especially on that particular project. Whatever you have the project, what is the application you are going in the your GMP work, it should be special training on that. So system specific training, appropriate qualification and experience corresponding to their assigned responsibility, especially corresponding to the assigned responsibility, duties, and access privilege, right? Sixth one, system requirement. Yes, I want to be come with the GMP activity, but with the computerized system. So what is the system requirement? Guidelines say, first of all, GMP functionality word. In this GMP functionality word, guideline expected that whatever the user requirement specification you want to be established, it should be run the show with all the functionality that you want to be automated, or you want that GMP activity run with the computerized system. This principle should be applied regardless whether the system is developed in-house, or commercial of the self product, or provided as a service. Okay? And independently on whether it is developed by agile method or a linear method. Whatever method you want to be developed, GMP functionality should be so wonderful without non-compliance. This is written in the GMP functionality. Second part is extend and delay detail. Means whatever be application you want be involved, it will very detailedly analysis first of all with your risk, with complexity, with novelty of the system, and describe sufficient support that mitigate your risk. Okay? And other all the documentation, other all the activity like risk analysis, specification preparation, design, purchase, configuration, qualification, validation should be run properly in the detailed way to mitigate all the risk and for non-compliant compliance on the your application. It should be included but not limited to operational, functional, and data integrity and all. So this extent is expected from the guideline. Next is ownership. So as we already discussed that whatever the system we are going to be implemented, like SaaS system we are implemented or off the shelf system we are implemented, the regulator user should be carefully review each and everything, because ultimately ownership with the regulator user only. Next, update. What is update? Update means the requirement always update when the system in operational level or throughout the life cycle of any system. So we have to update our requirement to ensure that it gives the functionality as we want, okay, in an accurate way. So this is written in this Annex 11 in update part. After that, traceability. As we all know, the traceability give us the opportunity that whatever the URS and whatever the requirement we identified in previous, and all the things are traceable or compensate with our validation activity, with our documentation, with our system, with our procedure. We prepare some document like traceability matrix. So guideline is also expecting that the activity, your work should be traceable. That's why guideline write documented traceability between individual requirement underlying in design specification and corresponding qualification and validation test case should be established and maintained. Next, configuration. So it should be clear what functionality, what we want to be configured in our system. It should be very clear. Means we can say that configuration specification should be very clearly so that the functionality, whatever we expected, can be obtained. And it should be controlled by your configuration specification only. So this all under the system requirement of this guideline. Now, seventh one is the supplier and service management. How your supplier play important role. This is very extended way mentioned in the Annexure 11. How you expect from your service provider. So in this part, first of all, responsibility. As we all know very well, either service provider, either your IT team, either anyone, the ultimately responsibility of the user. User is ultimately responsible for everything. Audits. User should take audits of the supplier or vendor to find out the, you can say, trust or assurance that the service provider give us the all the delivers and all the service in a such a way that any potential risk in our system can be mitigated very well. Third is oversight. Oversight means when regulated user is rely on service provider, there should be a agreement that we know, that SLA, service level agreement, in which all the things are mentioned. What are the supplier, what are the responsibility of supplier during the project and over the life cycle of the project. Okay, in this, the guideline introduced the key performance indicator. Means what are the key performance indicator of the supplier that you agreed should be mentioned, should be very much oversighted by the user. Now, fourth one is documentation availability. Means the documentation for activities required in this, you should it should be accessible to you also. But you can see that, you can identify, you should be review and can be explained from their facility. Supplier facility, from the supplier facility, the documentation can be explained also. Sometime the person from the supplier should also available at the time of audit to explain some activities also, some agreement like this also, or you can say some contracts are this also, this type also. Okay, so Same is written in contract part, and in this guideline, this is very much clear what is the minimum requirement in that contract. First of all, the description of activity and documentation to be provided by supplier. Second one, establish the company procedure and regulatory requirement to be met. Third one, agree on regular, or you can say regular, what is new, okay, what is new in the application. If we got any incident reporting, so we have to report that. Oversight, answer on time, resolution on the time, this is coming third part. Then fourth, agree on condition for supplier audit. Fifth part, agree on support during regulatory inspection if requested, that we already say in document availability also. Agree on resolution of issue brought up during the normal operation, audit and regulatory inspection, and define the requirement and process for communication of quality and security related issue. Define exit strategy by which the regulated user may retain control of system data. Agree on process of release of new system. So what is the nine part? What is the nine part? The contract should be contain the documentation part, establish company procedure, agreement of regular reporting, okay, and supplier audit, then availability of person in regulatory audit or the support in regulatory audit, then during operation the issue observed, they should help us to resolve that. Then communications process, then the strategy how they exit by which the regulated user may retain the control of system data, okay. So this is also mentioned in your contract. And last, agree on process for release of new system version, how they release the new version. So this is come in the contract part. So today we are understand from the 7 part only. Next part is alarm system, that we cover in the next video. So wait for next video. Till then, check again this 7 part, and we will, if you have any comment, you can add in comment section. Thank you so much. Watch this video till then. We will meet again. Thank you.